I'm Katie and I'm here to talk to you about diabetes and sleep. You may not be aware, as it's not very often talked about, that getting enough sleep is important for managing your diabetes. If we don't sleep well, it can affect our body's ability to manage blood sugar levels, and lack of sleep can also make us hungrier the next day, as our body searches for an energy boost. Most adults need between 7 to 9 hours of sleep, but everybody is different, and the amount of sleep needed varies from person to person. Temporary sleep problems are nothing to worry about. It happens and the body recovers. However, if you're persistently finding it hard to fall asleep, or your quality of sleep isn't very good, there are various approaches you can try to improve your sleep. First off, it's important to seek help for health conditions that are stopping you getting a good night's rest. For example, your GP can refer you to a sleep clinic for obstructive sleep apnea, sleepwalking, or similar types of sleep problems. If you have restless leg syndrome, you can be referred to a neurologist for treatment, and chronic pain should always be thoroughly investigated and treated. We all experience periods of worry from time to time, which can affect our sleep in the short term. This is normal and usually passes quite quickly. However, if stress, anxiety, depression, or anger is interfering with your ability to sleep, then help is at hand. If you live in Hampshire, iTalk is a free emotional wellbeing service and you can refer yourself. Find out more in our iTalk video. You may have come across the term sleep hygiene. It describes the day-to-day things you can do to help you sleep better. First off, make sure your mattress, pillow and covers are comfortable and supportive. Temperature is also important. For example, you may want to consider turning your heating thermostat down at night. Our bodies need a drop in temperature to trigger sleep hormones, and being a little too hot can prevent this happening. Too much light in the bedroom can really affect sleep. So if there are bright lights from street lamps or other buildings in the area, consider getting blackout blinds and curtains. Turn off garden lighting and try to minimise light inside your bedroom from things like TV standbys and charging phones. Eye masks and, if it's noisy, earplugs can also help. A lack of physical activity can also reduce your quality of sleep, and moving more during the day can help you sleep better at night. You can find out more in our exercise video. Sticking to a regular bedtime routine can also help keep your circadian rhythm on track. Take time to relax at least 1 hour before bed and avoid napping during the day, unless of course you work night shifts. Many of us enjoy caffeinated drinks such as tea, coffee, cola and energy drinks. But it's worth noting that caffeine stays in your system for many hours, so avoid caffeinated drinks in the 6 hours leading up to bedtime and stick to decaf instead. Be aware that even green tea contains caffeine, so don't get caught out. Nicotine can also disrupt sleep, so think about whether it might be time to give up smoking or gradually reduce the nicotine strength in your vape. Free help is available to help you stop smoking, and you can find out more in our video on smoking. Now, alcohol is probably one of the most misunderstood sleep aids out there. Alcohol belongs to a class of drugs called sedatives, and remember that sedation is not the same as sleep. Alcohol blocks rapid eye movement, or REM sleep, which is essential for our brain and our body to function. It also fragments sleep, so you wake up more often throughout the night. It's therefore a good idea to reduce your alcohol intake. Drinking less is also good for your general health and wallet. If you tried the approaches we've just outlined and are still struggling, see your GP. They may be able to prescribe a short course of medication or refer you for more specialist treatment if appropriate. Sleeping tablets will only be prescribed for 3 to 7 days at a time, as they are addictive, and although they can help alleviate some of the symptoms in the short term, they do not address the underlying problem. Long term, it is much better to find other ways of managing insomnia. Overall, you may have to try several approaches until you find out what works. For some, it may be as simple as prioritising sleep and going to bed earlier. For others, it will take longer to find a solution. It's important to remember that not all these options work right away, and they can take time and practice. Just find what works best for you.